Hi guys, this is cardiovascular part 2. First thing you want to do is make sure you have the pathway of the heart down. So I think this diagram does a better job than perhaps I could do. Start with the idea of blood having been delivering oxygen to the body and entering. So it's blue blood because it's already delivered its oxygen, and it enters through the vena cava, the superior vena cava if it's been to the upper body, or it enters here in the inferior vena cava if it's been to the lower body, then goes right atrium, right ventricle, pulmonary artery. From the pulmonary artery, it'll either go to the right lung, where it's oxygenated and returns in the right pulmonary vein, or it will have gone to the left lung, where it returns through it's oxygenated in the left lung and then returns through the pulmonary veins here. In either case, whether it returns from these pulmonary veins or these, it will go to the left atrium. So it's freshly oxygenated bright red blood to the left atrium, which will of course then go down to the left ventricle. Sorry, for some reason I lose during these screencasts, my cursor disappears in a way that it doesn't do so. Drives me so crazy. Okay, from the left atrium down to the left ventricle, and then a big strong pump out behind this artery, out the aorta, where the bright red oxygenated blood will go all over the body to feed the entire body. It curves down, makes a U-turn, goes behind the heart, and feeds the lower body as well. So make sure you understand this well. These videos can help you understand that pathway. Also, this diagram, I think, can help you understand that pathway. So make sure you understand that. Wanted to look at this question. Which of the two major pumps, so the atria are pumps, but in a very minor way. The ventricles are two pumps. They're the main pumps. Which of the two looks like a stronger pump? Can you just look at the muscle tissue and tell? Obviously, the right ventricle, I'm so sorry. The left ventricle, it's our right, but it's the true left ventricle. In other words, lost my cursor. In other words, this one, you can see how the muscular walls are much, much thicker and stronger. Why would this be a stronger pump? Because think about where the blood's going. It's going into the aorta, which means it's headed to the entire body. Has to make it against gravity to your brain and all the organs of your face, and has to make it all the way down to the tips of your fingers and your toes. So it's understandable why that has to be such a strong pump. In contrast, the right ventricle only has to pump blood to the lungs, so much less far. Okay, next thing is we've got 4 more parts of the heart to learn, and they're called the valves. So a valve, I should have written this out. I don't have this written. Let me just tell you quickly. A valve serves the purpose of controlling the direction of blood. It allows blood to flow only in one direction. If blood goes the wrong way, the valve shuts. In class, we compared it to like those doorways of some public transport systems that kind of like, what do you call it? Saloon doors that swing open in one direction, but will not be flexible enough to open the other way, except that these truly seal. So there's 2 sets of valves. The valves between the aorta and the ventricles on both sides, between the atria and the ventricles, These valves, we're going to call them AV valves, as in atrioventricular valves. So here's a set of valves, atrioventricular valves, these white, it's this thin white tissue with all these white strings hanging to it, right? So these are both AV valves. They actually have specific names, one for the right, one for the left, and we're not going to learn them because I think it's a nuisance to learn too many names. Then the other set of valves are the valves in the major arteries, so the pulmonary artery and the aorta, for the blood that's leaving the heart, and these are called SL valves, semilunar valves, because they have kind of a moon-like shape, and then also because, they also have the name I meant to say, pulmonary valve and aortic valve. The aortic one is kind of hidden behind, so it looks kind of weird there. Okay. Those are videos that will probably be useful to you. Tomorrow in class, we're going to be watching this video and this video. And this one is not in English, so turn off the sound, but the graphics are really good. Okay, attached to the valves are all those strings, literally the heartstrings, and they are called the chordae tendineae. And their purpose is that when blood is trying to flow against the direction of flow, they hold the valve shut tight. They make sure the valve seals and doesn't reverse its direction, and so they prevent the backflow of blood. They're actually attached to these little muscles too. Those little muscles there are called papillary muscles, and the strings hold tight when blood flow tries to reverse. Okay, this is another feature of the heart. This is what atria look like externally. Externally, atria are really odd looking. They are these kind of wrinkly pouches. They can sort of expand, so they're kind of scrunched up in the original form. They're a slightly darker color. So these pouches are called auricles. It's just this little, auricle actually means earlobe, so they're kind of earlobe-like structure on the outside of the heart. It's just the external part of the atria. Okay, more importantly and more interesting, this is a really important feature of the heart, which is, here's the aorta carrying all the oxygenated blood to the entire body, right? It's branching off to the arms and the heads, and then it's going to turn the corner and go behind the heart and go to the entire lower body and all the organs. But before it goes to nourish all those organs and all those body parts, there's a previous branching right here. The blood vessel branches off here, and also this is behind the pulmonary artery, but they're kind of giving you a little x-ray vision, letting you see it branches off there. And what is it branching off to do? To feed, can you guess what it's nourishing here? Heart muscle itself. Okay, so these are coronary arteries, which are the blood which nourish the heart muscle itself with oxygenated blood. It's kind of interesting that it's the very first branchings of the aorta, as though it's saying, okay, first priority, the first tissue that needs to be nourished is the heart tissue itself. On the right is just the back side of the heart. You can see how the coronary arteries distribute in that way. Another view which shows not only the coronary arteries, but also the coronary veins, because obviously if blood is being brought to the muscles, it has to have a return route. And so they follow pretty parallel pathways and structures. You can see those coronary veins returning to the heart. So again, here is the front view, and here is the back view of the heart. The yellow stuff is fat. Remember that fat is useful for padding and for cushioning and for holding things stable, holding things in place in lots of organs. Okay, so this is the next thing we're going to look at. The screen is cutting off the words, doggone it. Okay, this is a PLP in front of lax, so plaques. That's being cut off. All right, you can read this on your own and take notes on it. The basic idea is that the blood vessels can build up fatty tissue, which is deposited in these plaques. They also get calcified over time and get hardened. There's a lot to why this happens, but I just want to do a real quick and easy look at this, because you'll encounter it a lot. You'll hear about it a lot. These plaques build up over time, narrowing the pathway for blood, right? And this diagram shows it really well. There's less room for the blood to pass. And so the tendency to build up these plaques is called coronary artery disease. And this just really, they accumulate over time, but some people have more of a tendency to form them. Why is this so bad? Okay, it diminishes blood flow, and if something irritates the blood vessel and triggers clotting, so blood clotting is what happens when you start to bleed, right? You start to bleed, but the blood doesn't keep flowing forever. Your blood has a very elaborate mechanism for clotting. We'll look at that when we study the blood. It's actually really cool. But so your blood starts to clot. And when the blood starts to clot right near lost my cursor again there. When the blood starts to clot right near where there's been buildup, it can block flow entirely. Okay, it can block flow entirely, and it can cause a really serious problem, because now there's no blood reaching the tissues that are downstream of the clot. If this happens in a heart, so here's a picture of a heart. Okay, here's a picture of a heart. They're zooming in on this area here. You see that's where the clot is. That's where the plaques are in the clot. So what's happening downstream? Look at this. Can you see this tissue? This represents tissue that's being damaged and that's dying. By the way, not all tissue dies in a heart attack. Sometimes it can just be damaged and it can repair itself. But that's more or less what a heart attack is. Can happen in your brain and cause a stroke. Okay, this is a really fun thing to learn about. This is a method of, they send a little stent. A stent is, let me just show you what it is first. It's a wire mesh that's collapsible. And in its collapsed form, here it is in its collapsed form, they send it through your blood vessels. They often enter into your leg blood vessels or arm blood vessels and coil along your blood vessels. It's crazy the things they can do. And send this stent to the site of the clots, okay? When they arrive at the site of the clots, like right here, inside the stent is a little balloon. And so they inflate the balloon, and look what they've done. They're expanding the blood vessel right in that area. And they actually, sometimes they leave the stent in. This mesh basically becomes part of the wall of your artery. Sometimes they just kind of take it out and think they've stretched the area out. But in any case, they have enlarged the blood vessel to some degree and therefore allowed more blood flow. Another really common thing you might have heard of is coronary bypass surgery. So a blood vessel is taken from your leg or some other body part, and they use the blood vessel to make a detour, to make a bypass route. And so let's look at this picture. There's a blockage in the coronary artery right there, and they've taken this little additional blood vessel that they got from somewhere, and they attach it to the aorta, literally sew it on, and they attach it downstream from the blockage, and they've made this little detour route, right? So now, since blood is being blocked this way, there's blood that's going to be nourishing this area with another route, basically, another pathway. And so it's a surgery you've probably heard of. Sometimes you might have heard of people getting a double bypass. So this picture shows a double bypass. Notice that there's one there. I guess there's a blockage here and here in the picture, right? And they've put a blood vessel in there. They've put a blood vessel in there, and they literally just sew them in and attach them. So now you know what bypass surgery is. And these videos actually were not ready for yet, so I wouldn't watch those yet. That was just a few little items, easy items. Next, we're going to be studying cardiac cycle, which is difficult. So take advantage of all these easy little lessons. Learn these things. It's just a lot of names and I think fairly simple ideas. Okay, that's it.